My name is Wendy and I live in another part of Mexico, not in Tijuana. And I got here gratefully. I heard about the American Biological Dental Clinic from some people in highly skilled Chapala where I live. I was not well for a year or two, and I kept getting worse, and the doctors didn't know what was wrong other than feeding me lots of antibiotics. And finally, Doctor number 6 said, well, maybe you have a brain tumor or an aneurysm. So I said, okay, let's go for the MRI. And with the MRI, what it actually showed was 2 implants that I had done were entering, they were both in my sinuses. So the doctor who had put them in, I requested to have them taken out, and they didn't want to do any of that. I had to find an area that somebody would be prepared to take it out and know how to prepare the whole area once you do take it out. I also had 3 root canals at the same time. So in actuality, I was all swollen in the head, and the doctors kept thinking it was a sinus infection, which I would think after 48 days of antibiotics, the sinus infection might have gone away. So I came here, and I took a chance. I met 2 women who said they had been here for other reasons, and that they were quite satisfied, and it seemed really as though it was the only place I could go that somebody would even consider hearing what I had to say. So I was very fortunate, and they did surgery on me. It was a rather long surgery, but I was so badly infected, a lot of teeth had to be removed, and they also removed the 2 implants. And what they generally do here, which I found very fascinating, because on their website there's more information you can find out, but I was just so ready to come here, I really didn't care, I just wanted them out. They take your own blood, and by taking your own blood, what they do is they separate the plasma, which is your DNA, and they re-inject at first. Because of the root canals, the gum line was very, very badly infected, as well as because the implants were inside my sinuses. And the whole head was inflamed and infected. So they take the plasma. We had a cavitation done, which is what they do, is a scraping. Most people don't realize that even root canals are not always advisable, because after it's done, and even the doctor, he can be the finest doctor who's doing it. Once it's closed back up again, you don't know if there's bacteria. You don't know what's happening inside because nobody's looking. What I also found out, which was I found most fascinating, and they have charts here at the clinic, and you could probably find it on your computer as well too, is every single tooth in your mouth is directly connected to every organ in your body. If you're not feeling well about something and nobody seems to know what your problem is, it can also be because there's an infection, or you've got silver in your mouth, amalgam. You could have a crown or a bridge, and you could have an implant. And yes, I think implants have been a wonderful thing to help for people who have no other choices, but the thing is it's not just who does it. Everybody's learning how to put them in. Not everybody knows how to take them out. And what do? I would have been a statistic if I didn't come here and have them work on me. My first surgery was quite major. It was about a 6 or 7 hour surgery, which is a lot. And because I had no immune system left, I was not healing as well as I should. They do give you intravenous vitamin C during surgery and right after surgery. And the vitamin C is to maintain a healthier and strong immune system so that your body should heal better and heal faster. By re-injecting you, the cavitation was where they cleaned out wherever I had root canals done. And if I had a bridge that had silver or whatever metal that was used. So now I just have in the back here, the front ones are mine, which is kind of nice because when they do come out, you don't have that sunken in look that some people don't like, but I'm alive. I'm alive. I'm healthier than I have been in a while. I've never been a sick person. I don't take medicines or anything. But when you're sick, this has been almost a 4-year journey. And I now had my last bit of surgery. And my major surgery was a year ago in September. And it's now September 2015. And that makes 1 full year since my surgeries, and there were more than one, but it was necessary. And so I stayed. They got done what they needed to do. And like I said, the plasma is most fascinating because a lot of places, States, Canada, almost everywhere, what they're now using is so-called bone. They get bone powder, organic bone powder, and refill the area where they've taken the implant out. It is not the same as your plasma, your DNA, yours. It's not somebody else's. I don't care if it's organic or not organic. Your plasma, your body will accept always. Always. So, came back, needed a few other little touch-ups here and there, and I'm no longer the Walking Dead, and I'm very happy that I have my life back, and I'm very grateful for the American Biological Dental Clinic.